Clinical trials are part of the reason we were able to roll out a COVID vaccine so rapidly last year.
But they are also important to test any new potential medical treatment or test. The most difficult part of a clinical trial is getting people to sign up.
KXAN's Maggie Glenn explains how Elligo Health Research is partnering with a local pharmacy to help more participants.
Fabiola Hernandez trusts her local pharmacists at People's Pharmacy.
I have been coming here for about 15 years.
That's exactly why Elligo Health Research is partnering with the Austin Pharmacy to enroll more people into clinical research trials.
If people will hear about it through someone that they already have a trusted relationship with, outside of anything else that's just a part of their fabric of their everyday life, then that has a much better impact. And that relationship that people have with their pharmacist.
Fabiola says she would be more inclined to enroll in a trial if she heard about it directly from her pharmacist.
Yes, for sure.
Elligo will inform the pharmacists about new clinical trials so pharmacists can let their clients know based on their current prescriptions.
If we have a clinical trial coming, then we have a meeting with the pharmacists. We talk through the entirety of the trial.
And there's hope coming out of the pandemic, more people will be willing to sign up.
Healthcare workers have had an extra heavy burden during the COVID-19 pandemic, and it's also left people wishing they could do more. Those that aren't associated with healthcare wishing they could do more.
Maggie Glenn, KXAN News.
The first trial they'll be focusing on is a cancer screening trial that could potentially lead to an at-home screening method for colorectal cancer. If you don't go to People's Pharmacy for your prescriptions, you can still pop into one of their 4 locations to ask their pharmacist about current clinical trials.
Now you can look at the number of studies the National Institutes of Health lists online to see how this type of partnership really does help. Clinicaltrials.gov lists more than 400,000 registered studies currently ongoing. More than 3/4 involve some type of intervention, with the majority of those involving some sort of drug. And almost 40% of those are currently registered in the U.S. Most of those in the U.S. are exclusive. But data analysis point out that of the trials forced to end early, just over half are because a trial could not enroll enough patients. And that is the single biggest reason for trials to end early.